talk about treatments related to fertility problems, it is always allopathy. But did you know Ayurveda also has a cure, a very good cure in fact, for fertility problems? To talk about this, we have Dr. Mrutyunjaya Swami of Shatayu Ayurveda. Hello doctor, welcome to the show.
Thank you.
Doctor, when we talk about fertility treatments, mostly people associate it with allopathy. What is the role of Ayurveda in fertility treatments?
See, usually nowadays we are seeing a lot of fertility centers. In spite of being so many centers, you see the lot of failed cases. Because usually we also get in our practice 3 failed IVF, 5 failed IVF. The maximum one we got is 7 failed IVF. In such cases also we are getting a very good success rate. Usually we follow one particular policy called as, see for example one seed is there. If it has to grow a full-blown tree, it needs some elements to grow a full-blown tree. Seed should be good, quality of land should be, fertile land should be there, then proper water, air and light has to be there. So if these 5 things are there, there is no doubt that this seed will not grow into a full-blown tree. Anything is missing. For example, seed quality is not good, or fertile land is not there, or there is no proper water, or there is no proper light, there is no proper air, then that will not grow into a full-blown tree. So same concept we believe in Ayurveda and we treat accordingly. Whether it's a hormonal disturbances, lot of stuffs we treat when it comes to the infertility.
So what are the kind of patients you generally get?
See, usually nowadays, especially what happened because of the accessibility of the medical system to everyone, they try everywhere. When nothing is happening, then they come to Ayurveda.
Last resort.
Yes, because when it's getting failed, there are repeated abortions, repeated failed IVFs, are unable to conceive, and the moment IVF center says that you have to go for donor egg, donor sperm, they will become panic and they will come to Ayurveda. If they come initially, they will get a very good result. If they come later, then we will also face a challenge. But nowadays the system is so well advanced, so we do very good treatment and almost more than 96% success rate is there.
Oh, is it doctor?
Yes.
Okay. And how do you treat people with hormonal imbalances?
See, usually what happens, whenever there is an infertility, there are male involvement and female involvement. In male, there are some hormonal disturbances which causes the semen problem. And similarly in the female, there is some hormonal disturbances and their body make and their obesity and their lifestyle, food habits and all those things will cause the quality of the egg problem, whether it's a uterine problem and all those things. So let us discuss first about the male infertility. When it comes to the male infertility, majority of the cases we see azoospermia, where there is a zero count. There is absolutely zero count. So everyone, even for a layman language, it is understood that when there is a zero count, it's impossible to conceive. But that's not the case. First we have to find out why there is a zero count. Because when you are born as a male, the God has given all the organs to produce the sperms. Only thing, production is a problem. So we have to find out whether it's only a hormonal disturbance, whether a testicular problem. So accordingly, we'll come to know, because there are so many times we see seminal vesicle blockages also. So especially when it comes to Ayurvedic treatment, especially in our Shatayu, we are treating since 125 years only infertility. So we are mastered in it. So each specific cases, we have a specific individual specific treatments. It's not a generalized one. For example, I was explaining about the azoospermia. What happens if you go to a land, the fertile land where they have soaked the seeds and all, you will see a lot of area it is grown, but one area it is not growing. When you see there, the germing of the seed is not happening properly. So for that germination, we have a different treatment. After germination, if they are not growing, we have a different treatment. In growth also, if there is a head problem, we have a different, tail problem, we have different, and body problem, we have a different. And apart from that, semen analysis, if there is an infection, if there is a quality problem, that also we treat individual specific.
Why do you see a surge in male infertility these days, doctor?
See, nowadays the major contributing factor is obesity and the bad lifestyle. And nowadays what the adulterated food habits, what it's happening. And people are not so cautious nowadays like earlier. And they are not eating nutritious food. Quality food is not available. Olden days, this fried food and all these things, whatever is there, used to be available only on festival seasons. And that it used to be prepared at home. And you know which oil you are using and what is the quality of oil and how much quantity has to be eaten. But now that is not the case. Even the sweet is adulterated. Any food you take, lot of adulteration is there and we don't know. Especially post-COVID, we are seeing a lot of infertility cases, especially male infertility after the COVID virus attack. Because some people we have seen diabetes is affected, sugar, the insulin the production affected for some people, respiratory product, this one. And in some cases, we are seeing reproductive system also has got affected.
So how do you address female infertility problems, doctor?
See, even in the female, like male, what I said, there is a semen analysis problem. When it comes to the semen analysis, the moment they say that there is a zero count, azoospermia, we treat. Then there is a oligospermia, oligoasthenospermia, where what happens, the count is very less, motility also is less. So count less problem, then we have to give the medicine to improve the count. If there is a motility problem, we have an individual specific treatment to increase the motility. So similarly in the female pattern, when it comes, there is a blocked fallopian tube or PCOD or low quality of eggs or low AMH, low endometrial lining is causing a lot of problem. And so-called conventional medicine, see, right now integration is the key. Unless we integrate the systems, nobody is going to get a 100% result. Because we have seen in so many cases, in spite of we giving the treatment, we have sent for them either IUI or IVF. Because there is a lot of age factor also, quality of egg, because we can't wait for a long time. Female, they will get very fast the menopause. So those and all comes into the factor. So when it comes to the female, the quality of egg, endometrial lining and AMH, that is what the allopathic doctors are nowadays struggling a lot to increase that. They are unable to do it. That's why you see every alternate couple, they are telling that either you go for a donor egg or donor sperm. So that we address in our treatments.
So how important is integration here now, doctor?
Because what happens, see, every science has their own positives, their own negatives. So similarly in Ayurveda, see, we may be lacking in a scientific evidence. But according to Ayurveda, it's evidently effective treatments only we are giving. But only thing we are unable to explain the allopathy doctors. So, but now what happened, because of this adulterated foods and erratic lifestyle-induced disease, the infertility became like a lifestyle-induced now. So this time it's a need of the hour is the integration, because they have the completely advanced modern medical science where we have completely well equipped about the tests and all those things, which stage of the endometrial lining is there now, what is the AMH level, what is the quality of the egg, quality of the sperm, whether a motility problem, head problem, what defect is there, so that we must use it. But when they are facing a challenge of AMH or this endometrial lining or quality of the egg or sperm, this one, they have to rely on this treatment also. So if we integrate it, see, end of the day, people are not bothered with which pathy is treating, whether allopathy, homeopathy or Ayurveda. They want the result. So what you people are doing, it's an excellent job, especially integrating, especially this assisted reproductive, whatever the ART is going on. Integration is the must, and that is what is the long process to go.
But what is the success rate in Ayurveda, doctor, when compared to allopathy?
See, you won't believe, since 125 years with my great-grandfather era, we are treating only infertility cases. More than 96% result what we are getting. Because as I said you, when it comes to the quality of the sperm, if it is a motility problem, it is an infection problem, or count problem, or there is a zero count, we have everything different treatment. That's why Ayurveda could not get its recognition, due recognition, because one size will not fit everyone. Because if somebody may be having a low quality sperm because of the hormonal imbalance, there is a FHH problem, LH problem or testosterone problem. For all those three things, we have a different treatment. Then only they will get a solid result. Because we get a lot of people, they're saying that no, we have already taken Ayurveda treatment. We went to Kerala, we did a lot of Kerala Ayurveda treatment and all, but they could not succeed. Because they need a proper guidance. See, always I tell patient, once I know what is the problem, treatment will be easy. I can't give a generalized treatment. Because there is an infertility, there may be a sperm problem, there may be an egg problem. I can't give a generalized treatment. So that's why we give a very good individual specific treatment. We are getting more than 96% success rate. And lot of, I told you, the highest thing what we treated is 7 failed IVF. The 1 or 2 though we usually get. Recently Dr. Anita also told you, I think, the 4 failed IUI and 2 failed IVF cases. So total 6 they tried, and at last when they took the treatment with us, within around 9th month treatment, the pregnancy became positive, but that too naturally. So we are seeing a lot of failed IVF cases conceiving naturally with the simple detox and rejuvenation treatments.
So when patients come to you, they're generally stressed about this, doctor. What are the things that you do for their emotional well-being?
See, it's very, very crucial, that one, because by the time they went through so much of painful procedure, like first of all, they have waited for the child to get, then the social stigma, then the family one, everyone will be keep on asking. Apart from that, they tried so many attempts, it's not happening. Their mentality level will be, their mind will be so low, we can't even expect. So many people, when they were telling the problem itself, they'll start crying. So that level of mind disorder. So counseling is very, very essential, because the Indian society is dominated with male. Every female is like blamed always. The male even won't even go to check what is the problem. So we need counseling a lot. We take at least 30 to 45 minutes for one patient to first ascertain what is the exact problem. And then we tell them, see, getting a baby it's a combined effort, not one person effort. You can't blame somebody. Okay. So if somebody else's problem is there, so you have to support. Then the treatment will be easy, because there is one recent, the evidence. If you are seeing a movie, in the movie, if there is a murder scene, okay, and your hormonal disturbance happens the same the way you are seeing a live murder. So imagine these females and male, they watch so many movies, so many serials, nowadays a lot of social media. So they're going through a lot of turmoil, and these hormonal disturbances are happening a lot. So we tell them, we convince them. First, the main thing is we have to do a lot of consoling to them. Then it will be easy for us to treat. Once they become one, yes, this is the problem and this is the treatment available and this is the solution is there, then their approach will be entirely different.
So doctor, would you like to share some success stories?
Yeah, because we have seen a lot of, when it came to azoospermia, even the andrologist, allopathy doctor, even they, after going through the examination, after going through the TESA and PESA test. TESA is the one which they do to check whether there is anything alive or when that sperm production is happening or not. After seeing that, when the certified andrologist saying that no more sperm production will be happening to you and you can't get a baby of your own, you have to go for a donor sperm. Such cases also we got it. Okay, so what I want to tell the people is, the moment anybody says that you can't have a baby, that's the one science is telling, one system is telling. There are so many other systems. Why can't you try anta? Especially when it comes to the male infertility part, they have a very, very few medicine available in allopathy system or any other system. You won't believe, only Ayurveda and Unani has an excellent treatment when it comes to the semen analysis, the report card to improve. So that way, there is a azoospermia case. Then we have seen where there is already, the woman is 42. Usually you go to any doctor, they say that in IVF center, 42 it's impossible to get. You have to go for either surrogacy or a donor's egg, and that's also we can't say anything. Because after 42, the quality of egg drops, their AMH level drops, endometrial lining will be absolutely nil. So in that such cases also we have treated and they got a normal baby. That way they have not even gone for IVF. And the best thing was the 7 failed IVF. They gave up. Actually, they went to adopt a baby. Then they just they known to us, they said that, how can we adopt a baby? Then we said, why can't you try? You give a last try. Then we tried for a year, they got a triplets. Yeah, that is and the male was 48, female was 44. That was the worst case scenario we treated. 7 failed one, and age was already progressed, where all the doctors said that it's impossible to get a baby. Then during the lockdown, we have seen lot of natural babies. When the dad was failed, then we used to send the medicine through courier and all, and we got a lot of children. So my intention of telling them is, the moment anybody says quality of egg is a problem, endometrial lining is a problem, PCOD is there, because majority of the cases, they give the lame excuse that there is a PCOD, there is a cyst formation, you have to go for surgery. And you won't believe, even in male, when they are not getting a semen analysis, when it's coming to 0, they get into unnecessarily varicosity, you go for surgery, your testis is small, you can't produce a baby. So these are all lame excuses nowadays, a lot of doctors are giving. See, I'm not against doctors, but I'm telling, let them try some other place. That's why we are doing this program called as an integration of infertility treatment, like part to parenthood.
Just an awareness.
It's an excellent effort actually, because a lot of people don't know. They don't even know that there is some other system exists. At least few people know there is something called Ayurveda. So many people don't know what is Ayurveda also. So we got almost more than 90%, 96%.
Even if they know Ayurveda, they will not know that they'll address fertility issues and all that.
That is true. Lot of people think that it's only like that immunity medicine, some detox, some rejuvenation people, they give some massage and all they do. But that's not so. We give a specific treatment.
So what is your advice to people who are actually looking at conception and all that?
See, any couple where the other system or other doctors advise them that you can't produce your own baby with your own sperm, your own egg, please, that's not the end. This program has been done only for that parent to pathway days. There are so many other systems, which nowadays the integration is the key word for that. So please don't lose the heart that whatever you just text message to this program, we'll give you the solution, or you send your reports. So our doctors will do a counseling session, or they do the online consultation. Then they sell the we even send the medicine to this one, and we keep a lot of confidentiality about them. We never share the details and all those things. So don't lose hope. There is a hope available in the medical science, whether it is in the form of Ayurveda or allopathy or homeopathy. But in Ayurveda, we are getting a very good success rate. 96% is not a joke, because nowhere they will get a 90%, 96% success rate. Even a zero count, no sperm count, no egg quality, no endometrial lining. Even if there is a PCOD, don't lose hope. There is a solution for it.
So when you lost hope with all the IVF treatments and all that, remember that's just a comma. Ayurveda can always be a full stop. Thank you so much for being on the show, Doctor.
Thank you.